Hello, this is Dr. Behnam from Santa Monica, California, and today we have one of our lovely patients with us who we are treating her for acne scars. Welcome, welcome.
Welcome, thank you.
So we did a TCA cross technique for acne scars in September, so around in January of 2020. So roughly about 3 months ago.
Yeah,
So how did it go?
it went pretty well.
Good. So tell us, so from one session, what percent improvement did you see in your acne scars?
I saw like 60 to 80%.
That's a lot.
Especially like this side. But I mean, I had bigger scars.
Yes.
But I saw better results.
Better result, yes.
Yeah.
So I agree. So I think she saw at least 50 to 60% improvement. I agree. You still have the scars, they're just not as deep as before.
Yeah.
So when we did the TCA cross, so how did you feel that day? I mean, did it hurt a lot? Was it, what happened?
I didn't feel anything, but when you put the chemicals, I guess,
Yeah.
I felt kind of burning and
Yeah.
some redness,
Yeah.
but it went away
Yes.
in like 3 to 2 days. But
Okay.
after that, I felt nothing, no redness, anything like
Anything
that.
else?
Yeah,
No pigment. Now, look at the face. So we also had to use a bleaching cream because
Yeah.
you're a little bit darker skin, like my skin tone. So there's always a risk of pigmentation, and we had to use the bleaching cream to kind of prevent that. And looking at your skin, we actually compared your photos to last time, and we didn't see much pigmentation. Is that
Yeah.
correct?
Yes. Yeah,
Perfect. So that's
correct.
very good. So I did look at her photos from before, and you had a lot of linear, deeper indentation in the skin. And with this TCA, they just stimulate those collagen production, basically filled it in. And we're gonna show some of that. So today we're gonna do the second session. I typically recommend about 3 to 4 sessions, but I think you did really well with just one session.
Yeah.
The question I always get is that typically darker skin, they just come up and say, Doc, I'm gonna pigment. I did this at home and I got rid of pigmented. The trick is one, the way you do it, and number two is really the bleaching cream that really helps a lot. So today we're gonna do the second session. Are you excited about this?
Yes, of course.
Perfect, great. Here we go. Let's do the second session. I'm gonna put on my gloves so she has already washed her face. Yes, please remove the glasses. Okay, guys, so we're about to do the TCA cross. This is TCA 80%. And again, what we're gonna do is call this the paint technique. We're gonna paint it into her acne scars, and it's going to frost up. You really want to be right within the acne scars, and the technique is important. So some of the other ones, like the ice pick one, just want to dab it in there, but the ones that are linear, you want to basically do this linear paint on it. You're just gonna have to maneuver the tip so you get it right into the acne scars. You want to make sure that you don't get too much TCA on the applicator because you don't want it to be dripping all down her face. How did you feel then? Now you have such a huge improvement with the acne
I was
scars.
so happy.
Good.
And
That's the whole point.
yeah.
We're just painting it on, guys. We're gonna try to hit every little spot. Does it feel hot? How does it feel?
Yeah, it feels kind of hot
Warm?
and burning.
Burning?
Kind of like burning.
Take a little bit closer to the front. Let's go with this side. Just that away. Okay, so if this is a little long linear one, so we're gonna paint over it. We can call it the paint brush technique. These small ones kind of like very similar to ice pick, so you want to go right directly into them. see how she's frosting right in that area. Make sure we get all the edges. Just finished doing our second round of TCA cross techniques on this acne scars. She's got a very good result with the first session. She actually, I think, got better than the average. Typically, I usually say about 10 to 15%, but she did really well. And this is the reason why I always do TCA first couple sessions before I either do subcision or CO2, because you want some of those deep scars to fill in before you start resurfacing them. Thank you so much. Have a good day. Thank you.